I want you to imagine something for a moment. You've spent decades of your life relying on the same private routine. It felt natural, automatic, familiar, and for years it worked just fine. But what if the exact technique that once supported your pleasure and confidence is now quietly working against your body after 60? My name is Dr. Alexander Ree. I'm a board-certified urologist, and for more than 20 years I've worked with men over 60 who want to maintain not only their health, but also their intimacy, their confidence, and their sense of connection to themselves. In today's session, I'm going to walk you step by step through how to adapt your self-touch practices so they remain safe, healthy, and genuinely satisfying. We'll also talk about when it's smart to reach out to a doctor, what signs should never be ignored, and how to shift your mindset from frustration to confidence. So if you're ready, let's begin. First, let's acknowledge the elephant in the room. Most men were never taught how to adapt their sexual habits as they age. We learn as teenagers or young adults, and we repeat the same techniques for decades. They become second nature. Fast, firm, focused only on reaching climax. But here's the truth. Your body at 60, 70, or 80 is not the same body you had at 30, and ignoring those changes doesn't make you strong. It makes you vulnerable to problems you could have easily avoided with just a few adjustments. That's not weakness. That's wisdom. Let's break down what's actually happening in your body. As we age, testosterone production declines gradually. That doesn't mean your desire disappears, but it does mean it may feel less spontaneous, less urgent, and more dependent on the right setting. At the same time, circulation changes. Blood vessels become less elastic. Blood flow to the penis can slow, making erections slower to build and sometimes harder to maintain. Nerves, too, are affected. They don't carry signals as quickly as they once did, which means touch that used to feel sharp and instant can now feel muted, delayed, or inconsistent. None of this is your fault. It's simply biology. But what many men do is double down on old habits. They grip harder, move faster, and chase climax as though effort alone will bring back the feelings they remember. Instead of helping, that actually harms. Too much pressure can damage small vessels. Too much speed can overwhelm the slower nervous system. And focusing only on the finish line creates stress hormones that block pleasure entirely. The good news: there is a healthier, safer, and more enjoyable way forward. Let's start with the most common silent mistakes men over 60 make during self-touch. Mistake number 1. Using the same grip strength as in your 20s. With thinner skin and more delicate blood vessels, what used to feel stimulating can now feel harsh. A tight grip reduces sensitivity over time and even risks small injuries you may not notice right away. The fix is simple. Lighten up. Use a gentler hold and remember the goal is not force, it's sensation. Mistake number 2. Moving too fast too soon. A nervous system that processes signals more slowly doesn't respond well to rapid motion. Instead, slower, rhythmic, consistent touch allows your brain to actually register what's happening. Mistake number 3. Skipping lubrication. Many men still believe lubricant is unnecessary for solo activity. But with age, natural moisture decreases for men as well as women. Dry stimulation increases friction, which can lead to micro-tears, irritation, and delayed soreness. A gentle, unscented, water-based lubricant changes everything. Apply it early, not as an afterthought. Mistake number 4. Forcing climax. Older bodies often respond in waves. Arousal builds, fades, and builds again. That's normal. If you treat climax as the only measure of success, you'll frustrate yourself and activate stress hormones that suppress arousal. Allow yourself to enjoy the process. Mistake number 5. Ignoring signals. Too many men go on autopilot, repeating the same routine regardless of how it feels. After 60, the most important skill is listening. If something feels dull, change it. If it feels uncomfortable, stop. If it feels unexpectedly good, stay with it. The point is connection, not performance. So what does a safe, adapted routine actually look like? Let me guide you step by step. First, choose the right time. Block out 15 to 20 minutes where you won't be interrupted. Rushing creates tension, and tension kills circulation. Second, set your environment. Soft lighting, comfortable temperature, maybe even calming music. Your brain needs cues that it's safe and relaxed. Third, begin with your breath. Before you touch, take 5 slow breaths in through your nose and out through your mouth. This signals your nervous system that it's time to relax and receive. Fourth, use lubrication early. Warm it in your hands, spread it gently, and let it become part of the experience, not just a tool. Fifth, explore gradually. Don't go straight to the most sensitive areas. Imagine this as a massage rather than a machine. Explore different pressures, angles, and rhythms. Sixth, pause when needed. If arousal fades, don't panic. Sometimes a short pause and a return later can create even more pleasure. Seventh, keep breathing. Breath keeps blood flowing and helps you stay connected instead of distracted. Now, let's talk about posture. Many men overlook how position affects blood flow and nerve function. Sitting on a hard chair or leaning forward can compress pelvic nerves. Try reclining with pillows, lying on your side, or elevating your legs slightly. Small adjustments can make a big difference. Some men also benefit from aids like warming sleeves or textured devices designed to create sensation without requiring force. These are not toys in a childish sense. They are tools like glasses for vision or hearing aids for sound, meant to support a changing body. But technique is only half the story. Mindset matters just as much. Too many men carry silent guilt, shame, or frustration when things don't feel the way they used to. They assume they're broken. You are not broken. You are evolving. Self-touch after 60 is no longer just about stimulation. It's about presence. It's about creating a space where your body feels safe, respected, and cared for. This means letting go of outdated rules, that it must end in climax, that it must be fast, that it must look the same as it did decades ago. Instead, embrace slowness, embrace curiosity, embrace satisfaction that may come in different forms. Sometimes it's a gentle release. Sometimes it's simply relaxation and connection. Both are valid. Both are healthy. Now let's shift to when you should consider speaking with a doctor. While many changes are natural, some signs mean your body is asking for help. There are 4 major red flags. Number 1. Persistent pain or discomfort, such as stinging, burning, or irritation that doesn't improve with lubricant or gentler technique. These symptoms could mean inflammation, infection, or tissue sensitivity that requires treatment. Number 2. Sudden or ongoing numbness. A gradual decline in sensitivity is common, but sharp loss of feeling or dead zones may indicate nerve problems. Early evaluation is critical for best outcomes. Number 3. Difficulty getting or maintaining an erection even in private, relaxed settings. That may indicate circulation or hormonal issues. Remember, erectile function is often an early warning sign for cardiovascular health. Ignoring it could mean missing the chance to address a bigger issue like heart disease. Number 4. Emotional distress. If every attempt at self-touch leaves you anxious, ashamed, or disconnected, that matters. Sexual health and emotional health are linked, and a good doctor will support you without judgment. If you notice these signs, how do you start the conversation? Keep it simple. You can say, "I've noticed changes in how my body responds during solo activity. Is this normal aging or something I should check further?" Mention specifics: dryness, reduced sensation, or blood flow concerns. Any experienced urologist will understand immediately. And remember, reaching out is not weakness. It is strength. It is choosing to care for yourself, which is exactly what your body deserves. Before we close, let's tie everything together. Safe, satisfying self-touch after 60 is not about chasing what once was. It is about discovering what works now. It's about loosening your grip, slowing your pace, using lubrication, respecting pauses, listening to signals, and most importantly, shifting your mindset from performance to presence. Your body is evolving, and with the right approach, your pleasure can evolve with it, becoming more mindful, more connected, and more deeply satisfying than you may expect. Now, one last note before you leave. Even with perfect technique, there's another factor older men often ignore: the impact of regular self-touch on prostate health. Most men don't think about it until problems appear, and by then, options can be limited. In my next video, I explain exactly how self-touch relates to your prostate, what habits protect it, and what habits put it at risk. If you care about staying healthy and confident for years to come, I strongly encourage you to watch that next. Because your health is not just about avoiding problems, it's about staying ahead of them. But before we finish, let's go even deeper, because sexual health after 60 is not just about what happens in the moment. It's also about how you take care of your body every single day. Let's start with your prostate. This small gland, often overlooked until there is a problem, plays a huge role in your comfort and sexual well-being. As men age, the prostate can enlarge, which may affect urination, blood flow, and sensitivity. Gentle and regular self-stimulation, when done correctly, may help support circulation in the pelvic area and keep tissues healthier. But just as important is knowing when to seek medical support. Annual checkups after 60 are not just optional, they are essential. A simple conversation with your doctor can prevent years of discomfort. Next, let's talk about lifestyle. You cannot separate sexual health from overall health. What you eat, how you move, and how you manage stress all directly affect your experience in the bedroom and beyond. Diets rich in leafy greens, omega-3 fatty acids from fish, nuts, and seeds, and foods high in antioxidants like berries or pomegranates all support vascular function. Better blood flow equals better erections, stronger sensitivity, and improved recovery. On the other hand, high sugar intake, heavy alcohol use, and smoking silently damage the very vessels you rely on for pleasure. Think of every meal as an investment not only in your heart and brain, but in your intimacy as well. Movement is another key. You don't have to run marathons to benefit. Even 30 minutes of brisk walking most days of the week dramatically improves blood flow to your pelvic region. Gentle strength training helps maintain testosterone levels, which protect muscle mass, bone density, and yes, sexual performance. Simple pelvic floor exercises, often overlooked, can improve bladder control and boost circulation in the very muscles that support erections. Think of these as preventive medicine you can do at home, with no prescription required. Now let's consider breathing and relaxation. Many men underestimate how much stress interferes with pleasure. When your body is flooded with stress hormones like cortisol, circulation narrows and arousal becomes harder to maintain. One of the simplest, most powerful techniques is mindful breathing. Before and during self-touch, focus on slow inhales through the nose and steady exhales through the mouth. This calms your nervous system, signals safety, and enhances sensation. Some men even integrate meditation or gentle yoga stretches before intimacy, reporting not only better performance but deeper enjoyment. Let's also address the mind. Aging brings not only physical changes, but also psychological challenges. It is normal to grieve the differences between your younger and older self, but staying stuck in comparison is destructive. Instead, reframe your perspective. You are not losing, you are evolving. What once was fast and urgent can now become slow, intentional, and mindful. Many men find that, with the right mindset, intimacy after 60 is richer, deeper, and more connected than anything they experienced in youth. This is your opportunity to redefine success, moving away from performance and toward presence. And finally, don't forget relationships. If you have a partner, open communication is essential. Too many couples suffer in silence because one or both partners are afraid to talk about changes. Honesty builds intimacy, and intimacy is more than physical. Share your concerns, your needs, your fears. You may be surprised to find your partner feels the same or has been waiting for you to speak up. Together, you can create new routines that respect both of your changing bodies. This journey is not just yours, it can be shared. Let's now widen the lens even further. Sexual health after 60 is not just about intimacy or private routines. It is a reflection of your entire body's condition. Every system in your body is connected. Your cardiovascular system, your hormones, your nervous system, even your sleep cycle. When one of these is neglected, it often shows up first in sexual health. That is why we use the phrase, sexual health is a window into overall health. If you want to improve your confidence, your erections, and your satisfaction, you must care for the whole picture. Let's start with sleep. Too many men underestimate its role. Deep, restorative sleep is when your body balances hormones, repairs tissues, and strengthens blood vessels. If you are not sleeping at least 7 hours most nights, your testosterone can drop, your stress hormones can rise, and your sensitivity may dull. Studies show men who chronically sleep less than 6 hours often present with erectile challenges years earlier than those who prioritize rest. Simple habits help. Keep a consistent bedtime, dim lights 1 hour before sleep, and limit late caffeine or alcohol. Think of sleep as the most natural performance booster you have, and it costs nothing. Next, hydration. Blood flow depends on volume, and volume depends on fluid balance. Even mild dehydration thickens the blood and makes circulation less efficient. That's why older men who drink only a few cups of water a day often feel fatigued and less responsive sexually. Aim for steady hydration throughout the day, not all at once in the evening, which can interrupt your rest. A simple check is your urine color. Pale yellow means hydrated, darker means you need more fluids. Now let's revisit hormones. Testosterone is central, but it is not the only hormone at play. Cortisol, your stress hormone, competes with testosterone and reduces desire. Insulin, your blood sugar hormone, if poorly managed, damages small blood vessels and nerves, especially in the pelvic region. This is why men with diabetes often experience erectile challenges. By stabilizing your blood sugar with balanced meals, you protect not only your heart but also your sensitivity. Nutrition deserves special attention. Think of food as medicine. Dark leafy greens supply nitrates that relax blood vessels. Oily fish like salmon or sardines provide omega-3 fatty acids that reduce inflammation. Nuts, pumpkin seeds, and beans deliver zinc and magnesium, minerals your prostate and testosterone rely on. Even small additions, like a handful of walnuts or a daily green smoothie, can transform vascular health over months. On the other hand, highly processed foods, excess sugar, and heavy fried meals silently clog arteries and blunt responsiveness. One of the simplest upgrades is to follow the Mediterranean pattern: vegetables, fruit, legumes, fish, olive oil, and whole grains. This way of eating is strongly linked to lower risk of heart disease, diabetes, and yes, improved erectile function. Exercise is another pillar. Imagine circulation like a river. If you never move, the water becomes stagnant. But when you walk, climb stairs, or train your muscles, that river flows strongly. Aerobic activity, like brisk walking, cycling, or swimming, strengthens your heart and vessels. Resistance training keeps testosterone levels more stable. Flexibility and balance exercises like yoga prevent injury and improve pelvic blood flow. Even 10 minutes of stretching before bed can prepare your body to relax and receive pleasure. We must also discuss mental health. Too many men carry silent burdens, financial worries, family responsibilities, regrets. Stress lives in the body. It tightens muscles, narrows blood vessels, and distracts your mind from pleasure. Learning tools to manage stress is not indulgence, it is essential medicine. This can be as simple as daily breathing practice, journaling, or speaking with a therapist. Remember, when your mind feels safe, your body can perform better. Another overlooked area is social connection. Loneliness, which is unfortunately common in older men, directly reduces testosterone and increases stress hormones. Having trusted friends, sharing meals, laughing, or spending time with grandchildren all feed your hormonal and emotional system. Connection is not separate from sexual health, it fuels it. Let me also address an uncomfortable but important topic: medications. Many men take prescriptions for blood pressure, cholesterol, or mood, which can subtly affect sexual function. Do not stop medications on your own, but do speak to your doctor. Sometimes a small adjustment or a switch to a different drug can dramatically improve function without sacrificing safety. You deserve to ask these questions without shame. Prostate health requires a closer look as well. After 60, regular checkups are essential. Not every prostate enlargement is cancer, but ignoring symptoms like weak flow, frequent urination at night, or pelvic discomfort is risky. Simple screenings can give you peace of mind. At the same time, some research shows that a healthy pattern of ejaculation, whether through self-pleasure or partnered intimacy, may support prostate comfort by reducing fluid buildup. Balance is key, not force, but regular gentle release when it feels natural. Let's tie this all together with a vision. Imagine your body as a trusted partner. If you respect it, listen to it, and care for it, it will reward you with energy, confidence, and intimacy. If you ignore it, push it, or judge it, it will withdraw. After 60, pleasure is not a lost chapter, it is a new one. Slower, deeper, more mindful, and often more satisfying. By caring for your sleep, hydration, food, movement, stress, and relationships, you build the foundation for years of healthy sexual expression. So here is my challenge to you. This week, don't just focus on technique. Add one new supportive habit. Drink more water, walk daily, eat a colorful salad, go to bed earlier, share your feelings with someone you trust. Each small step builds a stronger foundation, and over months and years, that foundation transforms your life. I want to leave you with this thought. Aging is not the end of pleasure. It is the evolution of pleasure. When you stop fighting your body and start listening to it, you discover that satisfaction is not about speed or force, but about presence and connection. Your journey does not end here. It begins anew with wisdom and respect. I'm Dr. Alexander Ree. Thank you for trusting me again today. Remember, the way you care for your body, your mind, and your intimacy will shape not only your health but the quality of your years ahead. Stay proactive, stay compassionate with yourself, and never stop learning. I'll see you in the next video.